Greetings once again. And again and again. I don't know how many of these agains I've had now. Must be 30 something. Well, I'm back. And I've had my first zapping today. Last Tuesday I was fitted for my mask. A blue piece of piece of plastic placed over my face, moulded and pushed down into my eye sockets, my mouth, my nose, and then cooled with ice packs so that it moulds, so the face is actually to the shape of everything across here, across the face. And a CT scan. That was last Tuesday. I've had a wonderful, perfect few days, Thursday and Friday with my auntie, up at Weymouth, just the two of us, sitting on a beach, 4 o'clock in the morning, having a cup of tea outside our apartment, just doing life and making memories. Went to Monkey World, taking time to be with people who It's fallen down! Hold on! Hang on! Well, I hope this follows on from the last time, because the whole thing's just collapsed and had to refit everything back again. So I hope this kind of flows a little bit. But I was just saying that I've had a wonderful time at Monkey World and everything at Weymouth with my aunt, making memories, doing life with the people I care about. Saturday, the weekend, was pretty full on with my family, my cousins, which was wonderful because I actually got a lovely, heartfelt feedback from my cousin, Becca, who is a third year finishing nurse, about to qualify and graduate and move on to a job, which is fantastic. But she's been watching these podcasts and gave me some lovely feedback, which was valued like you wouldn't believe. But I guess what I'm wanting to say in this particular podcast in relation to professional practice is looking back and I guess reflecting on being told the news the other Monday at the hospital. I feel sometimes patients need to try and understand a little bit from the professional point of view. Nikki, who was the lady who gave us the news, she had a 6-bed bay and she had 6 patients to give 6 different kinds of news to. So she was preparing herself, going behind the curtain, telling the patient some news, coming back out from the curtain, going to the next patient, doing the same thing. She got to my bed and had to tell me the most devastating news you could possibly tell somebody. And she did it. You can't tell a doctor you've done a good job. But I stood up and gave her a hug after she told me that it's 2 to 3 months, it's a matter of weeks more than years. And that, the potential way it's going to show itself, this tumour, and the treatment and the symptom control. They are human beings, these people, and the nurses have to run around behind these doctors, picking up the pieces and tying up the threads of what has just been told. And that, my dear nursing students, is an art form. Because every patient, as you know, is very different, will react differently, will have different reflective ways of thinking and absorbing news. And you have to paint the picture. You have to brush your way through their life with your drug rounds and your medications and everything that you're doing, your paperwork and everything you're doing behind the scenes. But you also have to somehow be there at the same time and have that intuitiveness about you to know that that patient isn't managing in the bed. That patient may be being a little too buzzer happy because they've just been given some pretty devastating news, so they're going to be a bit frightened and they're going to be a bit unsteady, so they might press their buzzer a few more times than usual. But there was one particular fantastic nurse who was there at the hospital the other week, who knew exactly that, yes, I had just been given some very devastating news. I wasn't buzzer happy, but I had withdrawn. So she brought my anti-sickness tablets exactly half an hour before the meal. And she didn't make a fuss of me, but she was on the spot with all the medication. She was on the spot with everything I needed. If I so much as budged from my bed, she was there to help walk me to the toilet. She didn't have to say, "Are you okay? Are you all right?" She didn't have to fuss like that. And she didn't. She simply watched and looked and understood. Those are the kind of skills you don't learn in books. Those are who you are. That's what makes you the human being that you are. Because when I do these podcasts, I'm doing these to several universities now. I am very humbling, extremely humble to say that. Very blessed by Peter and the guys who are sending these podcasts out to the universities. But I'm not talking to a bunch of students. When I look into this camera, I look into the eyes of individual people. Each one of you has a history. Each one of you has your strengths. Each one of you has your own story. And your strength as well as your weaknesses. And it is pumped into you at university to work to your limitations. Where you understand your strengths as well. And those times that you have felt really rough, really bad, really low, you turn those times round and you make them into your positive experiences because you learn from them. Because they are what make you who you are. Sometimes it's your mistakes that make you who you are more than your strengths. Understand yourself before you start trying to understand others. Don't forget yourself as a human being, as an individual, as a nurse. Because once you put that blue uniform on, sometimes you can blend into the tapestry of the ward. But you don't. Because the patient doesn't see that. The patient sees that individual nurse. Where's Emma? Emma's not on today. Vanessa's not on today. So-and-so's not on today. You become, especially on somewhere like C4 or the long-term, long-stay wards, like cancer wards, or in the community. You become an individual to that nurse. I know, oh, Mrs. What's her name, what number this? But they'll know, oh, I know Gina, or I know nurse so-and-so. She likes to have her hair like this, she likes to do this. They're watching you just as much as you're watching them. So when I look into this camera, I look at you. And I see, yes, I see a camera. But what I am looking at with my mind and my heart, this is why I'm doing these podcasts. What I see and feel are individual human beings who are either setting out in their first year at university, big years at university, Freshers' Week and all the excitement, or you're going through the murk and the heaviness of the second year, which is pretty tough going, the second year. Or you're the third year and you've got the light at the end of the tunnel, which is not a train coming the other way. It's, it's the prospect of actually putting into practice all that you've learnt. What I see with my heart are people that I want to reach, to say, understand yourself. Like Nikki, who told me the news that I have. She's senior SHO. I'm sure she was senior SHO for the ward. And she came down, she pulled the curtains round, she sat down and she told me news that she knew I was expecting. Pretty much I had prepared, as my husband was sat next to me, but it was still hearing the words. We weren't expecting brain tumour, that was a bit of a shocker. But that's being reduced through radiotherapy. But there's no treatment now for the liver or the lungs. But she treated me as an individual. And I wanted to honour her by giving her a hug and saying she's amazing, because she was. And I gave her a hug and said, what you do is an art form, is tremendous, and it is appreciated. And sometimes us patients do need to appreciate what it is to be your side. Just one more.